Imagine delivering precise anesthesia in an ICU, not through and for, but with the very same gases used in the operating room. Welcome to the world of anesthetic conserving devices, a breakthrough that is changing the way we manage sedation in critical care. What if you could use volatile anesthetics like isoflurane and sevoflurane, commonly used in the OR in the ICU? With the anesthetic conserving device, or Anaconda, this is now a reality. The ACD bridges traditional anesthetic machines with ICU ventilators, making inhalational anesthesia accessible for critically ill patients. The Anaconda 1 is installed in place of the HME filter in the ventilator circuit, connected to the Y-piece and the endotracheal tube or flex tube. 2. The Anaconda should be positioned at an angle, tilted slightly downward toward the patient to prevent fluid accumulation, as shown. The Anaconda gas sampling line 3 is connected to a gas monitor or patient monitoring unit with a gas module. 4. The sedative agent line 5 is threaded onto a full syringe placed in the syringe pump. 6. The ventilator settings 7 must account for the added dead space from the Anaconda and flex tube or adapter. We're exploring the game-changing benefits of anesthetic conserving devices, or ACDs. 1. Reduce drug consumption by recycling anesthetic gases. ACDs can cut drug use by up to 90%. That's a huge cost saver for hospitals. 2. Environmental impact. Less drug use also means less environmental waste, a big win for eco-conscious healthcare. 3. Versatility. What's amazing is that ACDs can be used with standard ICU ventilators. So, even critically ill patients can benefit from inhalational sedation. 4. Rapid titration. Need quick adjustments in sedation? No problem. Volatile anesthetics with ACDs make that super easy. 5. Faster weaning. Studies show that ACDs help patients wake up faster and reduce the time needed to come off the ventilator. Next, we're talking about anesthetic conserving devices, or ACDs, and while they bring a lot of benefits, there are some important limitations and considerations to keep in mind. Let's dive right in. 1. Increased dead space. First off, ACDs add a bit of dead space to the ventilator circuit. What does that mean? Well, it essentially means the device creates a small area where gases don't exchange efficiently. This might sound minor, but it can affect how well your patient is ventilated. So, you'll need to tweak the ventilator settings to ensure everything is working just right. 2. Dosing and monitoring. Next up is dosing. ACDs require close monitoring, especially when it comes to the levels of anesthetic gases. Volatile anesthetics can fluctuate, so end-tidal gas monitoring is crucial to keep everything balanced. This ensures the patient gets just the right amount, neither too much nor too little. 3. Training needs. Here's a big one: training. ACDs aren't your typical anesthetic devices. They work differently from the standard setups, which means healthcare teams need proper training to use them effectively. Without it, there's a risk of improper dosing or even patient safety concerns. 4. Cost considerations. And finally, cost. Yes, ACDs reduce drug consumption, but there's an upfront cost for the device itself. For some hospitals, especially in resource-limited settings, this can be a barrier, even if long-term savings are promising. So, while ACDs offer some great advantages, it's important to weigh these considerations carefully. Finally, we're diving into the clinical applications of ACDs. These devices are revolutionizing sedation and anesthesia, especially in critical care settings. Let's break it down. First up, ICU sedation. For patients on ventilators, ACDs allow us to use volatile anesthetics instead of relying on traditional 4 sedatives. This makes sedation management more flexible and precise, ideal for both short and long-term needs. Now, what about prolonged procedures? ACDs shine during surgeries that require extended anesthetic management. They ensure a smooth and steady sedation, reducing the risks of fluctuating drug levels. For patients with organ dysfunction, such as liver or kidney impairment, ACDs are a lifesaver. Volatile anesthetics are minimally metabolized, meaning we can safely use them without overwhelming the body's detox systems. And of course, we can't forget about COVID-19. During the pandemic, ACDs were game changers. With 4 sedative shortages worldwide, these devices provided a safe, effective alternative to sedate critically ill patients, helping us navigate through those tough times. ACDs aren't just a technological advancement, they're a solution for complex clinical scenarios. Whether it's sedation in the ICU, managing prolonged surgeries, or treating patients with organ dysfunction, ACDs are making anesthesia safer and smarter. If you're interested in learning more about how ACDs are transforming ICU sedation, check out the latest studies on our website optimalanesthesia.com, where you'll find in-depth resources and the latest research. Don't forget to like, subscribe, and hit the bell icon for more videos exploring the future of anesthesia.